I wanted to talk to you a little bit about how I use hypnosis in my practice. Many people think of hypnosis as something like a stage trick, like something you might see on stage at a nightclub or at the local fair. Well, I am here to tell you that that is a fun demonstration. But clinical hypnotherapy has been used for many years as a powerful tool to create change in your life. Habit control, for example, such as smoking cessation or changing harmful eating patterns, thus leading to losing weight, reducing the effects of stress on the body, dealing with fears such as test anxiety, bridge phobia, fear of heights, like being in an airplane, fearing medical procedures that are coming up, addictions, including alcohol, and many others. I have gone to many trainings and read many books and to many seminars to learn these types of techniques. But I would like to give special tribute to my friend and mentor, Dr. Michael Preston, who was the author of Hypnosis, Medicine of the Mind. He trained and mentored me for nearly 15 years in dealing with all kinds of problems using hypnosis. Now, I have also had other excellent teachers who have added a lot to my knowledge base, and I do continue to study and keep an open mind and read over the research so that I can keep up with current trends in the field. I now have decades of clinical experience with this work. I firmly believe that this is one of the greatest ways for change to occur. Now, I'd like to take a few moments to exactly describe my process to you so that you can decide if you would like to explore doing this together with me. In a first consultative session, which takes about 1 hour, I take a detailed history of the problem that you're wanting to address. I also explain in greater depth to you how and why hypnosis works, and I also gather from you the very specific details of how you would like to think and feel and behave differently. You can decide after that session whether or not you want to proceed. If you do decide to proceed with this process, I generally schedule about 3 hours of time. The first and main change session lasts about 2 hours. During that time, you would experience what I have just described in greater detail during our first meeting. That would be induction, progressive relaxation, deepening imagery to help you get to a more relaxed state with longer and slower brainwave frequencies. And then following that is an age regression to take you back in time before the symptom-producing event. This is always done in a very safe way so that you would not re-experience negative experiences that you could have had earlier in your life. I think that's important. And then we turn around and take some time to address psychological baggage, which could be addressed and attached to your issue. And after that, we test for depth to make sure you're in a deep enough state to make it work. And then after that, we put in place the desired new beliefs, attitudes, values, behaviors of how you would like to be different in your life. And then finally, after that, you would return gradually from this deep state of hypnosis to being fully awake, aware, and alert. You can drive home. At the following session, which lasts maybe 1 to 2 hours, we would address any unresolved issues which might have cropped up in the meantime between our visits. And I also teach self-hypnosis to you, and we make a recording of that so that you can use this on a daily basis to reinforce the new suggestive therapy. And finally, I also add in the teaching of a technique which can quickly reduce cravings or stress. Any intense emotional feelings can be brought to a neutral state so that you can deal with any severe stressors that might come along. It's kind of a system reset in times of stress. Now, these are, in my estimation, the two most powerful psychological techniques known to man to help with underlying issues pertinent to your problem. So there's no need to take any medicine or any other action besides changing and using the medicine that you create in your own mind. If you think that this process could be helpful to you, I'm hoping that you will call and schedule a consultation. I look forward to speaking with you.